Hi. So before dealing with the diseases of uveal tract, we will see how the anatomy of uveal tract goes. Okay? So the anatomy of uveal tract. Uveal tissue constitutes the middle vascular cord of the eyeball. So you all know the eyeball is divided into three cord, right? First one is fibrous cord, second one is vascular cord, and the innermost is nervous cord. So today we are dealing with the uveal tract, which is the middle vascular cord of the eyeball. So from anterior to posterior, it can be divided into three parts, namely iris, ciliary body, and choroid. So from anterior, front to back, we can divide this uveal tract into three. Okay, first one is iris, second one is ciliary body, and third one is choroid. So in this picture, you can see this is iris, this is ciliary body, and this is the choroid. Okay, so this is the uveal tract, this is uveal tissue. So this is the middle cord of the eyeball. This is the middle cord of the eyeball, that is vascular cord, and it consists of three parts: iris, ciliary body, and choroid. That first one is iris. Iris is the anterior most part of the uveal tract, as you saw, right? Iris is the anterior most part of the uveal tract. It is a thin circular disc corresponding to the diaphragm of a camera. That the picture shows a cut section. If you see a 3D image, you will understand this is a thin circular disc corresponding to the diaphragm of a camera, and in its center is a aperture. In its center you can see a hole of about 4 mm diameter called pupil, which regulates the amount of light reaching the retina. So in the middle of this iris, this circular disc, you can see a 4 mm hole that is known as pupil, which controls the amount of light to be fallen in the retina. At the periphery, the iris is attached to the middle of anterior surface of the ciliary body. So, this iris is attached in the middle of the anterior portion of the ciliary body. It divides the space between the cornea and lens into anterior and posterior chamber. So, this iris is dividing, uh, you all know, right? When you study the anatomy of eyeball, you already learned the eyeball is divided into two segments: anterior segment, posterior segment. Anterior segment is in front of lens and posterior segment is behind the lens, and anterior segment is filled with aqueous humor and posterior segment is filled with vitreous humor. And this anterior segment can again divided into two, right? Anterior chamber and posterior chamber. So this anterior chamber and posterior chamber, that division in the anterior segment is done by this iris. In front of the iris is anterior chamber, and behind the iris is posterior chamber. So this iris divides the space into between the cornea and the lens into anterior and posterior chamber. So this is the iris, and in between, in the middle, you can see a aperture, right? This is pupil of eye. So this regulates the amount of light to be fallen in the retina. In this picture you can see this is the anterior segment and this is the posterior segment, you all know, right? So this anterior segment is divided into anterior chamber and posterior chamber by this iris. So in front of this iris, this portion is known as anterior chamber, and behind that this portion is known as posterior chamber. So this iris is attached in the middle of the ciliary body. This is the ciliary body. In the anterior part, in the middle of the ciliary body only, the iris will get attached. Next comes the macroscopic appearance. Anterior surface of iris can be divided into ciliary zone and a pupillary zone by a zigzag line called colorata. So this colorata is a zigzag line in between the ciliary zone and the pupillary zone. So you have to imagine it like a disc. Okay, in the disc, in the middle, there is a hole. You can imagine it like a CD. CD, you can see a hole in the middle. So in a CD, there is a hole in the middle. In between this space, there is a zigzag line that will divide these iris into two parts. That is pupillary part, that is near the pupil is pupillary part, and the peripheral part is known as ciliary zone. This is divided by a zigzag line called colorata. Ciliary zone, it presents series of radial streaks due to underlying radial blood vessels. So in ciliary zones you can see radial streaks. It's due to the underlying radial blood vessels. And crypts are depressions where superficial layer is missing. So there the superficial layer won't be there, it is a depression. And crypts are arranged in two rows. Crypts also can be seen in two rows. The peripheral and central. The peripheral is present near the root of the iris. Root of the iris means it will join to the ciliary body, and central is near the colorata. You can see in this picture. So here you can see, this is a cut, it's a small portion taken, right? You have to imagine it like a CD. Okay, so this is the colorata. This is a zigzag line in the iris. This is known as colorata. This portion, this is pupil. Here comes the pupil. So near the pupil is known as pupillary zone, and this peripheral part is known as ciliary zone. So here you can see this is the radial streaks. This denotes the underlying radial blood vessels, and these things you can see, right? These are the depressions, crypts, where the superficial layer is absent, and you can see the crypts in two rows. This is the peripheral row, that is peripheral crypts, and you can see near the colorata these are known as central crypts. So these are two types of crypts. Crypts near the colorata is central crypts, and near the peripheral part or the root of the iris is known as peripheral crypts. This is ciliary zone. So iris is divided into ciliary zone and pupillary zone. This is ciliary zone. Next comes the pupillary zone, that is near the pupil. This part of the iris lies between the colorata and the pigmented pupillary frill and is relatively smooth and flat. That is relatively smooth and flat. And in this picture you can see this is an image of iris. So this is iris, and this zigzag line is known as colorata, and so this portion is ciliary zone and this portion is pupillary zone. And you can see all these things are crypts. So crypts can be seen near the colorata is central crypts, and near the periphery or root of the iris is known as, those crypts are known as peripheral crypts. So this is the pupil and this is the colorata. Okay. So this is the macroscopic structure of iris. Next comes the microscopic structure of iris. Iris consists of four layers which from anterior to posterior. First one is anterior limiting layer. So it is the anterior most condensed part of stroma. So after anterior limiting layer comes the stroma. So this is the anterior most condensed part of stroma, and this consists of melanocytes and fibroblasts. You know, right? Melanocytes will give the color. Previously, this layer was called endothelial layer of iris, which was a misnomer, means it was incorrect. So previously it was called as endothelial, but there is no endothelium, so it is not correct. So now they changed to anterior limiting layer, and this layer is deficient in areas of crypts. In the crypts we told, right, superficial layer will be absent. So in crypts this layer is absent. The definite color of the iris depends on this layer. Some people will have blue iris, some people will have brown, black, like that. That all depends on this layer. So the defective color, definitive color of the iris depends on this layer. In blue iris, this layer is thin and contains few pigments. If the people with blue iris means this layer is thin and there is no less melanocytes, the pigment cells are less, and while in brown iris it will be thick and densely pigmented. So the color of the iris depends on this first layer, that is anterior limiting layer. Next comes iris stroma. After anterior limiting layer comes the stroma. It consists of loosely arranged collagenous network in which are embedded the sphincter pupillae muscles, dilator pupillae muscles, vessels, nerves, pigment cells and other cells which include lymphocytes, fibroblasts, macrophages and mast cells. So, the stroma consists of, in the stroma of the iris present all the muscles, blood vessels, nerves, pigment cells, etc. Okay. So sphincter pupillary muscle and dilator pupillary muscle is important for the dilation and constriction of the pupil. The sphincter pupillae muscle forms 1 millimeter broad circular band in the pupillary part of the iris. It is supplied by parasympathetic fibers through third nerve and it constricts the pupil. So the constriction of pupil and dilation of pupil depends on the muscles present in the stroma of iris. So that is very much important. The pupil will decide how much light should fall in the retina, right? But that pupil's dilation and constriction is controlled by the muscles present in this iris. In that, the constriction of the pupil is by the sphincter pupillae muscle and that is supplied by parasympathetic fibers. Next comes the dilator pupillae muscle. Dilator pupillae muscle is lies in the posterior part of the stroma of the ciliary zone of iris. These myofilaments are located in the outer part of the cells of anterior pigment epithelial layer and it is supplied by cervical sympathetic nerves and this helps to dilate the pupil. So, dilator pupillae which is present in the stroma, in the posterior most part of the stroma, the myofilaments, the muscular layers are muscular filaments are present in the next layer, that is anterior pigment epithelial layer, and that will helps to dilate the pupil. So sphincter pupillae will constrict the pupil and this dilator pupillae muscle will dilate the pupil. Next layer is anterior epithelial layer. It is the anterior continuation of the pigment epithelium of layer. You all know the 10 layers of retina, right? In that, the pigment epithelium layer continues as anterior epithelial layer of iris and the ciliary body. So, this layer gives rise to dilator pupillae muscles we mentioned before, right? The myofilaments are there in the anterior epithelial layer. So, that is anterior epithelial layer. It is a continuation of the pigment epithelium of retina and ciliary body. Next comes the posterior pigmented epithelial layer. It is the anterior continuation of the non-pigmented epithelium of ciliary body and at the pupillary margin it forms the pigmented frill. So in the pupillary margin it will make the pupillary pigmented frill and becomes continuous with the anterior pigmented epithelial layer and it will get continuous with the anterior pigmented epithelial layer. And that's about the iris. So 4 layers are there. First one is anterior limiting membrane, second one is stroma, third one is anterior pigmented epithelial layer and fourth one is posterior pigmented epithelial layer. So this is the iris and this is the ciliary body. So iris is attaching in the middle of the ciliary body and this is the red color layer is the posterior pigmented epithelial layer which is continuing with the ciliary body. It's continuing with the anterior pigmented epithelial layer of the ciliary body and above this comes the anterior epithelial cells and this is the stroma and this thin line is the anterior limiting membrane which is absent in the crypts. So this is about the iris. This is the picture from Kurana. You can see here. This is the pigment posterior. This is the layers of iris. So posterior epithelial layer, anterior epithelial layer. This is the stroma, and this thin membrane is the anterior limiting layer. And you can see dilator pupillae and sphincter pupillae muscle in this stroma and anterior epithelial layer. Hope you understood iris. Ciliary body. Ciliary body is the forward continuation of choroid at ora serrata. So it is the we saw, right, iris, ciliary body and choroid. So choroid's forward continuation is the ciliary body at ora serrata. Ora serrata is a frill-like structure between the ciliary body and retina. You can see here, this is ora serrata. This frill-like structure is known as ora serrata. So this is the choroid. This choroid will end here in ora serrata and continues as ciliary body, and this is the iris. Okay. So in cut section, this is the cut section, right? Here you can see this as a triangle in shape, right? You can see ciliary body as triangle in shape. The anterior side of the triangle forms the part of angle of anterior and posterior chamber. So anterior part, this front part forms the angle of anterior chamber and angle of posterior chamber. So the anterior part forms the angle of anterior chamber and angle of posterior chamber. In its middle, the iris is attached. See, the iris is attached in the middle of the ciliary body. The outer side of the triangle lies against the sclera with a suprachoroidal space in between. So this is the sclera. This is the sclera. So outer surface will be in contact with the sclera. In between there is a space known as suprachoroidal space. And the inner side of the triangle is divided into two parts. This is the inner side. Inner side of the triangle is divided into two parts. The anterior part, it's about 2 mm. The anterior part here, the front part, having finger-like ciliary processes is called pars plicata. So this is where the ciliary process, finger-like structures are there. That is known as pars plicata. And the smooth behind the posterior smooth part, that is 4 mm. This is little longer, right? Is called as pars plana. So this is pars plana, and this portion is known as pars plicata. So the anterior portion is in contact with the sclera, and there is a space known as suprachoroidal space, and here the posterior part can be divided into two. In that only the inner part, that only the anterior portion is with finger-like structures, that is known as pars plicata with pleats. So pars plicata, and behind the posterior part is plain. So it is pars plana. You can see here this finger-like projections. This is known as pars plicata, and the plain portion is known as pars plana. And this is the iris, and this is the angle of anterior chamber. Okay, so this is the portion where a suprachoroidal space will be there between the sclera and the ciliary body. Here also you can see this is the pars plicata, and this plain portion is known as pars plana. Microscopic structure. From without inwards, ciliary body consists of the 5 layers. Supraciliary lamina. It is the outermost condensed part of stroma. Like iris, this is the condensed parts of stroma consist of pigmented collagen fibers. So supraciliary lamina. And posteriorly, it is the condition of suprachoroidal lamina, and anteriorly it becomes continuous with the anterior limiting membrane of iris. We learned, right, the anterior limiting membrane of iris. So it will continue as anterior limiting membrane of iris, and behind posteriorly it is a condition continue as suprachoroidal lamina. And the second layer is stroma of ciliary body. So Supraciliary lamina is the first layer. Second layer is stroma of the ciliary body. It is made of connective tissue of collagen and fibroblast, and embedded in stroma are ciliary muscles, vessels, nerves, pigments and other cells. So here also in stroma there are muscles, ciliary muscles, vessels, nerves and pigments. Ciliary muscles occupies most of the outer part of the ciliary body. In cut section, it is triangle in shape. So, the ciliary muscles occupies the outer part. And it is a non-striated muscle having three parts. Longitudinal fibers will be there, circular fibers will be there, and radial or oblique fibers will be there. And ciliary muscle is supplied by parasympathetic nerves from short ciliary nerves. So that is the stroma. Stroma consists of all the pigment cells, ciliary muscles and vessels and nerves. So ciliary muscles having longitudinal and oblique fibers, and it is supplied by parasympathetic fibers. Next comes the layer of pigmented epithelium. It is the forward continuation of the retinal pigment epithelium and anteriorly continues with the anterior pigmented epithelium of iris. And next comes the layer of non-pigmented epithelium. It is of cuboidal or columnar cells, columnar epithelial cells, and it is forward it's the forward continuation of retinal sensory retina. Sensory nerve layer is there that continues as layer of non-pigmented epithelium, and anteriorly it will continue as posterior pigment epithelium. So layer of pigmented epithelium will continue as anterior pigmented epithelium of iris, and layer of non-pigmented epithelium will continue as the posterior pigmented epithelium of the iris. And the fifth and last membrane is last layer is internal limiting membrane. So it is the forward continuation of internal limiting membrane of the retina itself. This outlines the non-pigmented epithelium layers. So these are the 5 layers of ciliary body. This is a microscopic structure of ciliary body. Next comes the ciliary process. The finger-like projections you see in pars plicata part of the ciliary body, that is known as ciliary process, and they are 70 to 80 in number. Each process is about 2 mm long and 0.5 mm in diameter, and they are white in color. So the structure, each process is lined by 2 layers of epithelial cells. The core of a ciliary process contains blood vessels and loose connective tissues. So, this ciliary process contains blood vessels and loose connective tissues. These processes are the site of aqueous production. Aqueous production means the production of aqueous humor. So, this ciliary process will produce or secrete which one? Aqueous humor. So, function of ciliary body, formation of aqueous humor. Ciliary muscles help in accommodation of lens. It helps in the accommodation of lens. So ciliary muscles ciliary muscles helps in the accommodation of the lens, because from the ciliary process only sonules are there. Sonules will help to hold the lens. So ciliary process are nothing but the finger-like projections in the pars plicata of the ciliary body, and it may be 70 to 80 in number, and they are white in color, and each structure has 2 layers of epithelium, and they contain blood vessels and connective tissues, and the main functions are production of aqueous humor and also helps in accommodation. So in this picture you can see these are the pars plicata, these are the ciliary processes. They will be 70 to 80 in number, and you can see sonules are emerging from there, and the ciliary muscles inside here will help to will constrict and relax, and thus this accommodation of lens will happen. So this will help for the accommodation of lens, this ciliary process and the sonules. So this is the iris. This is the iris. This is the angle of anterior chamber. This is cornea. This is sclera, and this is the ciliary body, and this is pars plicata, and this is pars plana. In pars plicata presents the ciliary processes. That is ciliary body. So iris over, ciliary body over. Next comes the choroid. Choroid is the posteriormost part of the vascular cord of eyeball, and it extends from optic disc to ora serrata. Ora serrata you saw, right? Optic disc is where the optic nerve will emerge. So it is the posteriormost part of the vascular layer, and it extends from the optic disc to ora serrata. And its inner surface is smooth, brown, and lies in contact with pigment epithelium of the retina. So the inner surface, the outer is the fibrous cord, middle is the vascular, and inner is the nervous cord. So the inner surface is smooth and brown in color and lies in contact with the pigment epithelium of retina. And the outer surface is rough and lies in contact with the sclera. So here you can see it is a rough and it is in contact with the sclera, and inner layer is in contact with the retina. In retina, the pigmented epithelium. It is in contact with the pigmented epithelium of retina. So this is the choroid from ora serrata to the optic disc. This is known as choroid. And here it is ciliary body and here it is iris. Microscopic structure, it can be divided into three layers. Suprachoroidal lamina, it is a thin membrane of condensed collagen fibers, melanocytes, pigment cells, and fibroblast. So suprachoroidal lamina, it is a membrane, thin membrane which contain condensed collagen fibers, melanocytes, pigment cells, and fibroblast, and it is continuous anteriorly with the supraciliary lamina of ciliary body, and the potential space between this membrane and the sclera is called suprachoroidal space, which contains long and short posterior ciliary arteries and nerves which supplies this uveal tract. So it is the suprachoroidal lamina, that is the first layer, which is a thin membrane. It contains melanocytes, fibroblasts and all, and it is continuation of supraciliary lamina, and there is a space between the sclera and this layer. It is known as suprachoroidal space. It contains long and short posterior ciliary arteries and nerves. Next comes the stroma of choroid. It consists of loose collagenous tissues with some elastic and reticulum fibers. It contains pigment cells and plasma cells, and its main bulk is formed by vessels which are arranged in three layers. They are from inwards, without inwards. These are layer of large vessels, layer of medium vessels, and layer of choriocapillaries, which nourishes the outer layer of retina. So that is very important, choriocapillaries. So layer of large vessels is known as Haller's layer, layer of medium vessels is known as Sattler's layer, and last is layer of choriocapillaries. So this is the stroma. Stroma consists of mainly elastic and reticulum fibers, and it also contains the pigment and plasma cells, and the main bulk is formed by the vessels. That's why this layer is known as vascular cord of eyeball. So these vessels again classified into three layers. You can see first layer is large vessels, second layer is medium vessels, and last one is capillaries, that is choriocapillaries. That is stroma of choroid. And the third layer is basal lamina. This is also known as Brecht's membrane and lines the layer of choriocapillaries. Choriocapillaries we told no, it will lines the layer of choriocapillaries. That is known as basal lamina or Brecht's membrane. Brecht's membrane. It lies in approximation with the pigment epithelium of the retina. So this is the Brecht's membrane. Brecht's membrane, it lined the choriocapillaries. So this is how the vessels looks like. This is large vessels, this is a medium layer vessels, and this is choriocapillaries. So this is suprachoroidal lamina. After that comes the sclera. This is from outward inwards. So sclera, suprachoroidal lamina, vessels you can see in stroma. This is stroma. In their large, medium, and choriocapillaries. Choriocapillaries is lined by Brecht's membrane. Brecht's membrane. That is about choroid. Next comes the blood supply of uveal tract. Mainly three blood arteries are there: short posterior ciliary arteries, long posterior ciliary arteries, and anterior ciliary arteries. Venous supply is through the small veins which drain blood from iris, ciliary body, and choroid and join to form the vortex veins. Vortex veins I showed you in that staphyloma videos, right? In equatorial staphyloma, it will be near that vortex veins outlet. So it is formed, the small veins from this iris, ciliary body, and choroid will join to form the vortex veins, and the vortex veins are four in number. They are superior temporal, inferior temporal, superior nasal, and inferior nasal. These are four vortex veins. They pierce the sclera behind the equator and drain into superior and inferior ophthalmic veins, which in turn drain into cavernous sinus. So this is venous drainage of uveal tract. So that's about the anatomy of uveal tract. Hope you understood that. Okay, thank you.